Welcome to class. I think it's time for us to get started learning, so we're going to move on to the next step in your book. And your next chapter is about gathering and appraising literature. I'm going to hit some of the highlights in the chapter. I hope you've already read it. As I've said before, and I will say many times, it's really important for you to read the chapter, even if you just read it quickly, before you listen to the lectures. When you read first, the things you don't understand in the reading may be clarified in the lectures. But sometimes if you haven't at least briefly read the chapters, then the lectures may make no sense and seem somewhat confusing to you. The second thing I want to point out for this week is there is a great deal of information that's important to you, and there are videos that have been prepared by research librarians from the university. And I have attached those videos within the learning management system. There's multiple of them, so I apologize for that, but they are short. They range from 5 minutes to about 12 minutes in length, each one of them on a specific area of searching the research. So there's one in there about the difference between a primary source and a secondary source. There's another about how to do searches. And I think that you will find all of those very well done. Again, they are done by research librarians at the university, one at another university, and these are the experts in searching. I highly recommend that you get to know your research librarian. I think that they are very helpful, and sometimes when you're doing research papers, in fact, almost always, it's a good idea to talk to them and get them to help you. When I'm doing my research, I always have the research librarian help me with that process, because I found out that taking 30 minutes to meet with a research librarian saves me many hours of effort of redoing and redoing work for something that they would have done right the first time. The purpose of this chapter is to introduce you to how to evaluate the literature review in a research study and how to critically appraise a group of studies for evidence-based practice and quality improvement projects. There is a difference in the way you would approach your research study and your literature review if it were for evidence-based practice as opposed to a research study. For most nurses that are getting their BS in, your first experience is probably going to be in a healthcare setting, either doing quality improvement or evidence-based practice projects, which is why I will spend throughout the course more time discussing that. The purpose of the literature review is to develop a strong base of knowledge that's necessary to conduct a study for evidence-based practice. So why do a literature review? Especially, why do a literature review for evidence-based practice? In your textbook on page 41, you will find a detailed list that goes into some explanation about each of these items, and I'm going to briefly cover them for you. First of all, you want to determine what is known and unknown about three things: your subject, the concepts within the area you want to study, and the problem. It's really important to find out what has already been done. That gives you a foundation to look at all of those previous studies. And through looking at those, you can see gaps in what they didn't ask or what they didn't do. And then you can look for the inconsistencies or the consistencies. So if I look at two studies, the two studies basically have the same findings, that's a good thing. But if I look at two studies and they both have very different findings, so for example, I look at studies about the effectiveness of nurse practitioners in a primary care setting and the outcomes for the patients as opposed to physicians. And one says nurse practitioners do a great job, the outcomes are equivalent. And the other one says nurse practitioners do a good job, but they cost more. Those are two slightly different things and two slightly different incomes. Boy, that was a Freudian slip. Those are two slightly different things and two slightly different outcomes. It then gives you the basis of which to do another study if you want to, or to keep looking in the literature. You want to synthesize the strengths and the weaknesses of the available studies and determine the state of the science on the topic or the problem. Not all studies are equivalent. Some are done with a lot more rigor. They're bigger, they're broader, they're more comprehensive. And others are done and they're just tiny studies that only have a few people in them. For many of us today, we know this from some of the early COVID-19 studies where people were making judgments on what to do based on a very small number of people in one isolated area. And then we found out that as people did bigger and bigger studies, that some things were not good. Hydrochloroquine was the example as a treatment. In a small study with a few people, they thought that it might have some promise, but when they did big randomized trials, all of a sudden they realized, no, actually the negatives were worse than the positives. So you always have to look at studies for strengths and weaknesses. When you're doing your literature review, you want to see that they describe the theoretical and conceptual frameworks that guide the study, and we will talk more about that in the next chapter. You want to determine the need for replication or refinement of a study. If the study has only been done by one person, you want to know, first of all, is it possible to replicate that study? Is there enough detail available that somebody else could do it? And if somebody else could do it, do they need to refine it? And if they already did it, did they come up with the same findings? If they did the exact same study and they came up with different findings, then that's problematic. It needs to generate a research question and hypothesis. And then you want to determine an appropriate research design, methodology, and analysis for a study. You want to provide information to discuss the findings of a study and draw conclusions and make recommendations for future research, practice, education, and policy changes. You should be beginning to get the big picture here that the literature review is really important. To me, it's equivalent to in nursing where we say that the history is the biggest part of anything you do. If you someday become a nurse practitioner, we'll sometimes tell you and teach you that the history is 90% of your diagnosis. What the patient tells you about their history matters probably more than what you see, because they know their health quite well. And they can tell you the story of their symptoms and the way their body is reacting and the medications that they're taking, all of the things that you need to know. And then a lot of the studies you do and a lot of the lab tests that you review as a nurse are because they are confirming what we found out or what we suspected by taking a history. The literature review is much like your history taking in a physical exam. The literature review also is designed to help you uncover a new practice intervention or gain supporting evidence for revising or maintaining current interventions, protocols, and policies, or developing new ones. Once you do the literature review, you may have had this wonderful idea that you think that you want to implement, and you don't know if anyone else has done it. But if your clinical question led you to something new that you would like to do, and you search the literature, you could find out that somebody before you has had this exact same idea. And in fact, they had implemented it and it worked well. Or you could find that they implemented it and it failed horribly. Just because one person didn't succeed in the implementation of a clinical practice does not necessarily mean the practice is bad or the idea is bad. It could have been bad implementation. That's why you look for sources in the literature that confirm or deny what you're finding. One study is never enough. You want to generate clinical questions that guide the development of evidence-based practice and quality assurance, or QI, projects, policies. And you want to identify recommendations from the conclusion for future research, practice, education, policy, and action. That's a lot riding on a literature review. But the literature review is one of those early steps you take to determine what you do next so that your practice and your research is always guided by existing evidence and gaps in that evidence. I took from your textbook Table 3.2, which are steps and strategies for conducting a literature search from an evidence-based practice perspective. And step 1 is to determine your clinical question and research topic. You want to make sure you focus on the types of patients or the population that is of interest to you. This is where it's important to remember your PICO question. And we spoke about this last week. PICO is your population, your intervention, your comparison group, and your outcome. Step 2 is to identify key variables and terms. So, review your library's online help and tutorials. For you, I have included those in our learning management system, and I have attached the relevant videos that I think will help you through this process. Step 3 is to conduct an electronic search using at least 2 and preferably 3, if needed, databases. And I will suggest databases to you and come back to this. But 2 at least, and probably 3, especially for evidence-based practice, I would say 3. And if you're doing an integrative review or you are doing a systematic review of the literature, then you may want to use more than that. And then review the abstracts online and weed out the irrelevant articles. And when you do your search, it's going to pull up some things that are totally irrelevant to what you're doing. And I would suggest that you go ahead and take those that are irrelevant and you just delete those off the top. Now, it's still a good idea when you first pull up your search strategy, there's going to be a screen that says how many articles you retrieved, and you'll probably want to screenshot that and save it, because you always want to be able to say, we started with X number of articles, and we found out that of those, 100 articles, 15 of them were actually relevant. Of the 15 then, that's where you start. But you always want to know what that very starting number was. Step 5 is to retrieve the relevant resources. So you want to organize them by the type of study and the design. And some of us who don't want to waste paper try to save all these on our computer and then put them into stacks. I will tell you that early on when you're doing research, it is much better off to print out your articles and start yourself stacks. These are the quantitative articles. Stack 2 is your qualitative articles. Stack 3, it may not even be research. It may just be somebody's opinion. You can stack those up because they may, well, you may not want to include them. They actually may have information that guides you to other sources. I think that at this point in your careers, that would probably be easier than trying to keep them all online. Then you want to store or print the relevant articles, and if unable to print them directly from the database, you have to order them through interlibrary loan. One of the things in my class that I ask students to do is I ask them to use a resource manager, and at the University of New Mexico, the one available to you for free is Zotero. Other universities have EndNote and other tools that you may use. But what you can do with that is you download the citation into it and you can attach the article. You're going to need to use one of these resource managers. That is the best way, in my opinion, to keep your articles and to manage them so you don't lose them. Now, another option is a Google Drive. And in my class, I will set up a Google Drive for you, and I will put a place in the Google Drive for you to store your research articles. And you can store all of the research articles there, and I think that that might be helpful to you. So I will also make that available. Step 7 is to conduct preliminary reading and elimination of irrelevant sources. So now remember, you've read the abstracts and you eliminated probably the majority of the articles just by reading the abstracts and said these are irrelevant. When you start reading the full articles, you're going to find out that probably more of them are irrelevant, and you're going to want to just put those aside. Now remember, always keep track of that number. The number you started with, the number you did the full review on, and then you will want the number you finally ended up with. Step 8 is, we'll conduct your preliminary review of them. And then step 9 is to critically read each source and use critical appraisal strategies. And there is a table in your book in chapter 20 that explains that. I'm going to talk a little bit more about critical appraisal in just a minute. And then finally, your last step is to synthesize critical summaries of each article. Decide how you will present the synthesis overall. Now, some people do annotated bibliographies and other people set up tables. And it can be in an Excel spreadsheet, probably better than a Word document, but in an Excel spreadsheet. And you can set up columns for the things that you are interested in. And you put the article, the the reference, the formatted reference, and then you might put different columns about what you want. In the course, I've provided you an example of that I think will be helpful to you. So some helpful hints. Remember, one article is never enough to count for evidence-based practice. And it's important to learn to read the literature and then critically appraise it to participate in evidence-based practice. And this takes a lot of practice. Read articles. The more articles you read, the better you will get at evaluating them. Now, I said I'd come and give you a little bit more detail on critical appraisal. So what does it mean to critically appraise an article? And you can find this in your textbook in more detail on page 57. The first thing you want to think about is, are the relevant concepts and variables included in the literature review? Is the literature review presented in an organized format that flows logically? Now, what logically means, I think that depends on a couple of things. First of all, to me, it depends on how my brain works, what's logical. And for you, it may mean something entirely different. But when I'm doing research, I tend to cluster articles by concepts and by variables. Other people may cluster their articles by time frames or in chronological order. I tend not to do that because to me in nursing, that doesn't mean a lot. The concepts and the variables, or maybe even the population, those things matter. Does the search strategy include an appropriate and adequate number of databases and other resources, published and unpublished? Here's what I would recommend. You really do need to have, in my opinion, at a minimum, PubMed and CINAHL for your searches. And if you were doing evidence-based practice, Cochrane. If you're doing a study on mental health, then probably PsycInfo. This is why it's always good to talk to your research librarian. They're always going to be able to tell you the best database for what you want to do. Are there both theoretical and conceptual and research sources used? Are many sources mainly, or primary sources mainly used? All right. One of the videos I included for you in the learning management system was about the difference between a primary source and a secondary source. This is something, and your book goes into a fair amount of detail about the difference, even gives you a table with examples of primary and secondary sources. This is something you really need to know. And for me, this is important because I'm kind of picky about it. I want you to use primarily primary sources. I will accept a few secondary sources, but as a rule, I do not want to see citations from somebody's textbook. I want it to be from articles and other databases. Now, other databases mean you may want to go to the Agency for Healthcare Quality and Research website and search there. There are other databases that collect research that may not be out in the published literature. Does the literature address gaps and inconsistencies in knowledge? And does the literature review and build on earlier studies? And then we want to say, does the summary of each review study reflect the essential components of the study design? Here are some of the things you want to look for at a minimum. Does it tell you the type and size of the sample? In other words, how many participants were in this study? Were the participants randomly selected, or were they selected by convenience? I'm a new nurse and I'm on a unit and we're doing a study and we're only studying patients that happen to be admitted to our unit. That's convenience. That's just convenient. It's not randomly assigned. You want to know things like that. You want somewhere in the article for it to have talked about reliability and validity of any instruments that were used, and then consistency of data collection procedures, the appropriateness of data analysis. This will be harder for you at this stage to know the appropriateness of data analysis. Some of this will require you to think back to the statistics course that you took and whether or not the statistical analysis is adequate or not. I would like to say that if it's in a peer-reviewed article, you can assume, but the truth is you really can't. A lot of stuff gets published that probably shouldn't have. Again, I think at this point in your career, this will be the hardest part, and it's not something that I'm probably going to expect you to be highly efficient at. Then, does the synthesis summary follow a logical sequence that presents the overall strengths and weaknesses of the reviewed studies? Again, logical is in the eye of the beholder. And does the literature review for evidence-based practice project answer a clinical question? So we're back to that clinical question, and remember that in the last module we talked about clinical questions always start with PICO components. So remember, population is the individual patient or groups of patients with a particular condition. Intervention is the particular aspect of healthcare that is of interest to the nurse or the healthcare team. Comparison is the standard care or no intervention or a comparison of two treatments. And finally, the outcome is the more effective outcome for the patient. Where do you start? You have a lot of work ahead of you. Always begin your search by visiting the library website and looking at the available databases. I've given you a link. Most of you, I'm sure, know this website. And then always use more than one database for your search, ideally 2 or 3. CINAHL, PubMed, Cochrane, especially for evidence-based practice, and Web of Science are probably my top recommendation, unless you're doing a study that includes mental health, in which case I would always say PsycInfo. On the UNM website, you can also find a specific link for nursing resources, and I've provided you that link, and it's also in the learning management system. In creating an effective search, you want to isolate the keywords of your topic. And since I gave you the topics, you can look at the titles and find a lot of those keywords. Narrow the search to keywords using these connectors that are in all caps. And if you want to get both words in your key search, if you want to expand the search, you can put or in between. So I could say nurse and or in caps, nurse practitioner, or registered nurse, and see what I get. So that would expand it. You can also use not if there's something you want to make sure that you don't get in your search. Then document your search strategy and keep track of it in your research journal. And I provided you a link to information on that. And then you can go to the website and find all of the UNM Health Services Library search videos that are available. And the ones that I thought were critically important for your progress for this course, I have linked to in the learning management system. Now, as difficult as this may seem, and not to make myself seem old, but I'm getting there, this is better than it used to be. When I was an undergraduate, this is how the libraries looked, and they had these things called card catalogs that were these big long drawers, and they looked like they had the information that you now pull up online typed onto a card. And if you wanted an article and you wanted to do a search, you had to search through these card catalogs by your topics. And then you had to handwrite all of this information down because we did not have cell phones that would have taken pictures of it. And then you had to go to the stacks and find the journal article and retrieve it. And you could sit there and take notes about what was in the journal article. There was no such thing as downloading it. However, there were frequently photocopiers that you could use, which were as expensive then as they are now to use. So most of us took note. So as complicated as this may seem to you now, it was worse. And today, the ability to do literature researches is greatly enhanced by the technology that we have. And I think over time that we will find that through the use of artificial intelligence and other information, that we're going to be able to greatly improve the searches that we do. And finally, I will tell you that there is nothing that is more helpful than finding a really high quality example of what you want to do. With integrative reviews, which is one of the things we will work on during this semester, this is an example to me of an exceptionally well done integrative review. It was the willingness of healthcare personnel to work in disasters, an integrative review of the literature. And it is by Mary Shafee. And I would highly recommend that you take a look at this article and you use it as a template for your work this semester. I have included this article in your learning management system for you. So there's a link to it and it will be easy for you to access. I hope you enjoy the rest of the course. The next section we will cover is Chapter 4, and I look forward to seeing you there. Thank you.